Mental health assessment is an essential part of a comprehensive physical examination. Unlike subjective data, which is based on a patient's self report, objective data is gathered through observation, structured assessments, and standardized tools. The goal of this assessment is to evaluate a patient's cognitive, emotional, and psychological well being, helping to identify neurological conditions, psychiatric disorders, and any cognitive impairments requiring further intervention. Mental status assessment includes both general routine screening and focused specialty assessments, which we will discuss. In nursing practice, mental status assessments are conducted at different levels. The general routine screening is performed on all patients as part of a standard health assessment. It includes evaluating the patient's alertness, behavior, appearance, speech, and cognitive function. This screening helps determine if a more detailed assessment is needed. The focused specialty assessment is conducted when cognitive or emotional impairments are suspected. This involves a deeper evaluation of consciousness, cognition, mood, thought process, and perception. This uses specific tools such as the Glasgow Coma Scale, the Mini-Cog, and PTSD screening tools. By distinguishing between these two approaches, we ensure that patients receive appropriate mental health care based on their needs. Before conducting a mental status assessment, proper preparation of the client is needed. Establish a comfortable environment. These reduce distractions and ensure privacy to promote open communication. Use a calm and reassuring tone to ease patient anxiety. Explain the purpose of the assessment. Inform the client that their responses will help evaluate cognitive and emotional health. Address any concerns about sensitive topics in a non-judgmental manner. Consider cultural and language differences. Use interpreters if needed to ensure accurate responses. Be mindful of cultural norms that might influence patient behavior or communication. For objective mental status assessment, we use several essential tools, including paper and pencil. These are used for cognitive tests such as drawing figures or recalling words. The Glasgow Coma Scale. This assesses the level of consciousness using eye, verbal, and motor responses. The PHQ-2 and PHQ-9, which are used for depression screening. The Columbia Suicide Severity Rating Scale could also be used to evaluate suicide risk in patients. The primary care PTSD screen for DSM-5 is used to screen for post-traumatic stress disorder. The St. Louis University Mental Status or the SLUMS exam is used to detect cognitive impairment. And the Alcohol Use Disorders Identification Test could also be used to assess alcohol dependence and misuse. These tools allow us to objectively measure mental and emotional functioning. Assessing the level of consciousness is a critical component of mental status evaluation. The assessment procedures include 1. Observe the patient's general appearance and responsiveness. Assess alertness. Does the patient respond to verbal or physical stimuli? Evaluate orientation. Ask the patient for their name, current date, location, and situation. Examine speech, thought processes, and memory for coherence. Normal findings include the patient is alert and responsive, oriented to time, place, and person. Speech is clear and logical. Abnormal findings could include disorientation, confusion, or unresponsiveness, slurred or incoherent speech, memory deficits, or inappropriate responses. For example, a patient with severe dementia may struggle to recall their own name or current location, indicating significant cognitive impairment. Next, we evaluate the cognitive functions of the patient. What are the key cognitive functions? Orientation to time, place, and person, attention span and concentration, recent and remote memory, abstract reasoning and judgment. How do we assess for these functions? Ask for the current date and location. Have the client recall recent events. For example, you may ask, "What did you have for breakfast?" Ask about long-term memories, such as, "Where did you grow up?" Use problem-solving questions. Normal findings include accurate recall of recent and remote events, logical reasoning, and problem-solving skills. Abnormal findings include difficulty remembering recent or past events, poor judgment and problem-solving ability, impaired concentration or inability to maintain attention. The mental health assessment tools help us evaluate a patient's level of consciousness, cognitive function, and psychological state. These tools provide objective measures that assist in diagnosing and monitoring mental health conditions. These tools serve a specific purpose in assessing brain function, memory, cognitive impairment, post-traumatic stress, and substance withdrawal symptoms. The Glasgow Coma Scale is widely used to assess a patient's level of consciousness, particularly in cases of brain injury, stroke, or neurological disorders. It evaluates three major areas. The eye-opening response, 1 to 4 points. 4 means spontaneous. The eyes open naturally. 3. Opens eyes to voice. 2. Opens eyes only to painful stimuli. 1. No eye opening. Verbal responses, 1 to 5 points. 5 means oriented, answers questions appropriately. 4. Confused but can respond verbally. 3. Inappropriate words such as random speech and doesn't make sense. 2. Incomprehensible sounds such as moaning or groaning. 1. No verbal response. Motor response, 1 to 6 points. 6. Obeys commands or moves as directed. 5. Localizes pain, tries to push away painful stimuli. 4. Withdraws from pain, pulls away but no purposeful movement. 3. Abnormal flexion, decorticate posturing or arms flexed inward. 2. Abnormal extension, decerebrate posturing or arms extended outward. 1. No motor response. The total GCS score ranges from 3 to 15 with the following interpretations. A score of 15 means normal level of consciousness. 13 to 14, mild impairment, such as in a possible confusion or disorientation. 9 to 12, moderate impairment. There is decreased alertness and inability to follow commands. Less than 8, severe impairment, such as in coma or unconsciousness. For example, a patient with a score of 6 may be unresponsive and only exhibit abnormal posturing, whereas a patient scoring 12 may be confused but still able to respond. This scale is critical in emergency settings to track neurological deterioration or improvement. The mini-cog is a quick and effective screening tool used to detect cognitive impairment, particularly in older adults. It is often used in primary care and hospital settings to assess for early signs of dementia. Steps in the mini-cog assessment includes the 3-word recall test. The patient is given 3 unrelated words to remember. They are asked to recall them later in the assessment. Clock drawing test. The patient is asked to draw a clock showing a specific time. This assesses executive function and visuospatial skills. Word recall. The patient is then asked to recall the 3 words given earlier. Interpretation. A score of 3 or lower suggests possible dementia or cognitive impairment and may warrant further testing. A normal score 4 or 5 suggests intact cognitive function. For example, if a patient forgets 2 out of 3 words and cannot accurately draw a clock, this raises concerns about early Alzheimer's disease or mild cognitive impairment. The 10 signs and symptoms of Alzheimer's disease. Alzheimer's disease is a progressive neurodegenerative disorder that primarily affects memory, problem solving, and behavior. The 10 early warning signs include memory loss that disrupts daily life, challenges in planning or problem solving, difficulty in completing familiar tasks, confusion with time or place, trouble understanding visual images or spatial relationships, new problems with words in speaking or writing, misplacing things or losing the ability to retrace steps, decreased or poor judgment, withdrawal from work or social activities, and changes in mood or personality. If a patient frequently misplaces objects, struggles to recall daily events, and withdraws from social interactions, further neurological evaluation is needed. The primary care PTSD screen for DSM-5 is a brief screening tool used to identify individuals who may have post-traumatic stress disorder. It consists of 5 yes or no questions assessing exposure to traumatic events, intrusive memories, avoidance behaviors, and hyperarousal symptoms. If a patient answers yes to 3 or more questions, further psychiatric evaluation is recommended. For example, a combat veteran who reports nightmares, avoids crowded places, and startles easily would likely require further PTSD assessment. The Clinical Institute Withdrawal Assessment for Alcohol is used to monitor alcohol or drug withdrawal symptoms. It assesses tremors, shaking of hands or body, sweating, increased perspiration unrelated to activities, anxiety, feelings of nervousness or restlessness, agitation, inability to stay still, pacing or fidgeting, hallucination, seeing or hearing things that aren't there, seizures, uncontrolled muscle contractions or loss of consciousness. A high CIWA-AR score indicates severe withdrawal and may require medical intervention, to prevent complications like delirium tremens. Common levels of consciousness abnormalities include lethargic, sluggish, drowsy response to stimuli. Obtunded, requires repeated stimulation to respond. Stuporous, minimal movement, responds only to painful stimuli. Comatose, no response to verbal or painful stimuli. For example, a stuporous patient may require vigorous shaking before responding, while a comatose patient remains unresponsive despite repeated attempts. Speech disorders can indicate neurological or muscular impairments. What are the common speech and voice disorders? Dysphonia, hoarseness, weak voice due to laryngeal disorders or cranial nerve 10 impairment. Cerebellar dysarthria, irregular, uncoordinated speech due to multiple sclerosis or cerebellar damage. Dysarthria, slurred or slow speech from Parkinson's disease, stroke, or muscular disorders. Aphasia, language impairment due to brain damage. We have Wernicke's aphasia. The person is fluent, but the speech is meaningless. Broca's aphasia, slow, difficult articulation, but meaning remains clear. To summarize, objective mental status assessment evaluates consciousness, cognition, and speech. Standardized tools aid in assessing mental and neurological function. Recognizing abnormalities enables early intervention.